For the past few months, the COVID-19 pandemic has been wreaking havoc around the world. What are your thoughts on what we are witnessing with this particular health crisis?
There's two sides to this that everybody is well aware of. On one side, it's the health-related issues, and then on the other side, the twin economic-related issues that we're dealing with, not just for things of today, but things that we're going to have to be dealing with in terms of a recovery across the board. And for the continent in particular, there's going to be a number of issues.
Very often, there is a tendency to turn to the international community when there is such crisis, whether it's in Africa or other parts of the world. But in this case, we see that the entire world is affected. So what can be done?
On the immediate side, we have to deal with the debt crisis. And I think there's a longstanding precedence for a moratorium on these or just refinancing a lot of the debt packages. Otherwise, we're going to be heading towards a default across the continent. And as we then look in the future, how do we deal with this? The old way of economic development, where essentially developing economies think about leveraging globalization, labor arbitrage, low-cost goods being manufactured on the continent to be sold internationally, that's not going to be the factor. I think you're going to find a lot of developed countries saying we need to produce the goods in those countries. And I think when we look at these domestic markets, there's some expertise that perhaps we're not recognizing. And I'm pointing towards the international aid architecture, the $150 billion of overseas development assistance that's principally executed by international development organizations. And so we took it upon ourselves at the Milken Institute to do a little bit of this research in partnership with UBS Optimus Foundation. We looked at 500 global INGOs that are working with their donors to do a range of health capacity building and delivery of commodities.
And what were some of the findings?
Well, what we identified was you should be looking at these entities from a couple of different pillars. On one side, there's a relationship that these organizations have with their donors. Their donors sometimes actually prevent their capabilities from really handing off into a commercial sustainable enterprise. So I think there's a change that needs to happen from the donor to the recipient organization. That's one thing that we identified. The second thing we identified was, well, how much capital and what type of capital are they using? Is this a place for impact investors to partner with INGOs to build social enterprises? Now the issue is we need to make sure that we advance growth potential over and above the risk potential because of how slow the economies have gotten. And so looking at Basel regulations to allow capital to flow in to spur these type of activities, that's in the control of not just the Basel Committee in Switzerland, but also in the country's central banks to make sure that recovery happens appropriately.
So there are some projections that Africa's GDP could be reduced by 3 to 8% this year because of the COVID-19 crisis. What do you make of it? And if you were to kind of summarize it, what kind of strategies can we put in place to make sure that resilient economies are built to be able to withstand such crises in the future?
To be honest with you, I think the estimates are probably a little too early. We were not exactly sure how much it's going to really dip down. I've seen ranges as north of 10, 15% across the board. So with that being said, the strategy to come back, I think it's rooted in a couple of pillars. On one end, we actually realized that the bedrock of being able to build back better, if you will, is going to be an infrastructure strategy, that making sure that the foundation, there are a lot of infrastructure gaps throughout the continent, and to make local, regional, and international markets work more effectively. The second thing we probably need to realize is there is going to be effectively a certain number of industries that countries need to make sure that they have the ability to have in-country supply chains, but also on a regional basis as well. And I'm talking purely on the medical devices and pharmaceutical front. And then the third one is recognizing that vulnerable populations are the ones that are always hit. And so how do we have an inclusive economy such that people can be a part of their own resilience going forward? And that means thinking a little bit more holistically about the inequality that is pervasive throughout the continent in various different countries, that we bring individuals into the economy, more women into the economy, more youth into the economy, and being able to actually have the bottom of the pyramid, if you will, the strongest part of the economy.
Aron Betru, thank you so much for joining us. We appreciate your time.
Always a pleasure. Thank you, Linord.